Hello, everyone. My name is Luke Umana. I'm a PGY5 surgery resident at Indiana University. I'll be attending Advent Health in Tampa, Florida next year for my MS fellowship. This was a study out of my institution in collaboration with Purdue University, and we were studying, and it's titled Comparison of Laparoscopic Robotic Ergonomic Risk Pick Your Poison. Disclosures: this study was funded by a SAGES grant. So minimally invasive surgery, we all know the benefits to patients. They're undisputable. But there's emerging evidence that this does affect surgeons and surgeon longevity in the form of work-related musculoskeletal disorders, which have been extremely common and reported at about 87% in laparoscopic cases. And now that robotics is becoming more prevalent, we have seen a high prevalence as well, around 23 to 80%. And so this is important for us surgeons in terms of longevity. And so, but the differences in ergonomic strain between these two platforms is unclear. And so this was the aim of our study, to identify the differences in subjective, perceived post-operative discomfort between both platforms, and then identify differences in muscle activity, reflective of workload between both platforms, and ultimately determine if one technique is superior in terms of lowering ergonomic risk to the surgeon. So we did a prospective study. We collected data from 20 different surgeons, 49 laparoscopic, 29 robotic, and we measured subjective data by administering perceived discomfort questionnaires preoperatively and postoperatively. And then we captured objective data in the form of biomechanical loads using EMG sensors and then also motion tracking technology sensors in the OR in real time. And so we were able to compare these postoperative discomfort and then also compare the objective evidence between both platforms. And this is a depiction, and this is the actual questionnaire we administered to the surgeons pre- and post-operatively. And then on the right there, on screen right, is a depiction of what the surgeon was wearing in the operative room. And the figure A there, you see our motion tracking sensors attached to the bicep, chest, head. And then our EMG sensors were attached to the deltoid and trapezius muscles. And these are the results for postoperative discomfort. We noted that in laparoscopic procedures, surgeons had an increase and reported right finger numbness and right arm and shoulder stiffness. And this is comparison to robotic procedures where surgeons reported an increase in their stiffness in the back. And then we had a trend in, we also collected more cognitive data as well, and there was a trend towards significance in irritability in the laparoscopic group. We then went on to describe if one platform was more likely to cause these. And so we noted that in comparison, robotic procedures were noted to have were less likely to have right and left hand and wrist pain, left arm and shoulder stiffness, and less arm and shoulder pain on the right side. And then this is the objective data that we used to compare the platforms. And so compared to laparoscopy, we noted that robotic procedures, there was increased static neck positioning, and then lower right deltoid and trapezius muscle activity, which is measured by the overall EMG activity. And then we noticed lower right deltoid and trapezius demand time activity, which was defined as greater than 10% of maximum muscle contraction, and then a lower left trapezius muscle activity. So what does all this mean? And so what we conclude is that laparoscopic procedures led to increased surgeon subjective hand and wrist and shoulder pain on the dominant side, as all of our surgeons here were right-handed dominant. And then robotic procedures led to lower muscle activity and muscle demand time on the surgeon's dominant side. But robotic procedures were associated with prolonged static neck positioning and a subjective increase in stiffness in the back. And so this kind of leads me to the question is, pick your poison. The robotics has been kind of touted as this platform of improved ergonomics. But as you can see, the platform, each one has its own unique ergonomic risk profile, which is important for intraoperative awareness. And we could even target with specific occupational or physical therapy, physical therapies to benefit and allow surgeon longevity. Happy to take any questions.